Question 1. Most common enzyme deficiency in homocystinuria. A 6-year-old boy presents with long limbs, downward lens subluxation, and a history of stroke at age 5. His urine is positive for homocysteine. Which of the following enzyme deficiencies is most likely? A. Methionine synthase. B. Cystathionine beta synthase, CBS. C. Phenylalanine hydroxylase. D. Dihydropteridine reductase. E. Tyrosinase. Correct answer B. Cystathionine beta synthase, CBS. Explanation. The most common cause of homocystinuria is cystathionine beta synthase deficiency. Homocysteine cannot be converted to cystathionine. Homocysteine accumulates, leading to connective tissue damage and thrombotic events. Why not the others? A equals another cause of homocystinuria, but less common. C, phenylketonuria. D equals involved in BH4 metabolism. E, involved in melanin synthesis, albinism. Question 2. Differentiating homocystinuria from Marfan syndrome. Which of the following findings best helps differentiate homocystinuria from Marfan syndrome? A, tall stature and long limbs. B, intellectual disability. C, aortic root dilation. D, arachnodactyly. E, upward lens dislocation. B, intellectual disability. Explanation. Both homocystinuria and Marfan syndrome can present with Marfanoid habitus. However, intellectual disability and thromboembolic events are common in homocystinuria, not in Marfan. Additionally, lens subluxation is downward in homocystinuria and upward in Marfan. Why not the others? A, C, D equals shared features between both conditions or not exclusive. Question 3. Treatment based on pyridoxine responsiveness. A patient with homocystinuria responds partially to pyridoxine, vitamin B6 therapy. Which of the following additional dietary recommendations is appropriate? A, increase methionine intake and restrict cysteine. B, supplement cysteine and restrict methionine. C, provide high phenylalanine foods. D, eliminate all folate sources from diet. E, increase sodium intake to prevent hyponatremia. Correct answer. Supplement cysteine and restrict methionine. Explanation. In B6-responsive homocystinuria, there is reduced affinity of cystathionine synthase for B6. Treatment includes high-dose B6, methionine restriction, and cysteine supplementation, because cysteine becomes essential. Why not the others? A equals the opposite of correct therapy. C equals relevant to PKU, not homocystinuria. D equals folate is often supplemented, not eliminated. E equals unrelated. Question 4. Cardiovascular risk in homocystinuria. A 14-year-old girl with known homocystinuria develops acute left-sided hemiparesis. Brain imaging shows a large ischemic stroke. Which of the following best explains her condition? A, elevated levels of homocysteine increase platelet count. B, homocysteine cross-reacts with myelin proteins. C, homocysteine causes endothelial damage and promotes thrombosis. D, accumulated methionine causes blood-brain barrier rupture. E, a deficiency in tyrosine results in increased vascular resistance. Correct, sir. C. Homocysteine causes endothelial damage and promotes thrombosis. Explanation. Homocysteine is directly toxic to endothelium, leads to intimal injury, procoagulant state, and increased risk of stroke, MI, and DVT, one of the most dangerous complications of untreated homocystinuria. Why not the others? A equals homocysteine does not affect platelet count. B, false, not a demyelinating disorder. D equals methionine accumulation is not toxic in this context. E, not involved in vascular tone here.